I'm going to try and give you an update on our efforts to develop a blood-based test that can detect lung cancer in smokers and in individuals who've never smoked tobacco. So, as many of you will probably be well aware, lung cancer is the leading cause of cancer deaths in the US and worldwide. In the US, it's expected that in 2010, around 157,000 lung cancer deaths will be reported. Most lung cancer cases are diagnosed as late-stage disease, where survival rates are very low. However, if lung cancer is detected early on, survival rates increase dramatically. As such, there's a real need to develop new methods to detect lung cancer early on when therapeutic intervention can be more successful. Now, clearly, most cases of lung cancer are associated with smoking. However, around 20% of all lung cancer cases worldwide are not attributable to smoking tobacco. This translates into over 300,000 lung cancer deaths each year in never smokers. What's more, the proportion of lung cancer cases in never smokers is expected to increase in coming years as smoking prevention and cessation programs are introduced. In recent years, more attention has focused on this never smoker group of lung cancer patients. And some interesting differences have started to emerge relative to lung cancer in smokers. For example, lung cancer in never smokers is seen disproportionately in women. And never smokers are commonly adenocarcinomas, often with bronchoalveolar features. Okay. Currently, imaging plays a central role in the detection of lung cancer. Computed tomography, or CT scanning, has a higher sensitivity than conventional chest X-rays in detecting pulmonary nodules. Indeed, preliminary data emerging from the National Lung Screening Trial, the NLST, has demonstrated that CT screening confers a 20% drop in lung cancer mortality relative to conventional chest X-rays. However, concerns still remain regarding the low specificity of CT scanning and the morbidity that is associated with the necessary diagnostic follow-up, be it through needle biopsy, bronchoscopy, or surgery. As such, we believe that biomarkers may serve as a valuable adjunctive tool to CT scanning, either pre-CT, serving as a filter to identify the highest risk individuals whose, with positive cases being confirmed by follow-up imaging, or post-CT, after a nodule has been identified in the lung, to act as a rapid, non-invasive method to confirm the malignant status of the nodule. Okay, so how have we gone about discovering and validating our biomarkers? Well, we've identified a novel panel of biomarkers using a mass spectrometry-based approach, where we've analyzed lung tumor tissues and lung cancer cell lines. We've performed this analysis in a highly focused fashion, focusing in on two key subcellular compartments, the cell surface and proteins being secreted from the tumor cells. What's more, we've restricted our analysis to markers that are differentially expressed in the disease state. In total, we've identified more than 500 candidate markers, and so we've had to prioritize these ahead of validation. We've also added in a number of previously characterized markers in an effort to identify a very optimal panel going forward. We've carried out immunoassay-based validation of 9 markers in serum collected from 4 independent case control smoker studies. A total of more than 600 serum specimens have been analyzed. After initially demonstrating strong performance for 7 of the 9 markers, we set about developing a lung cancer model. To achieve this, we randomly distributed samples into a training set and a test set. We developed a 6-marker logistic regression model on the training set and applied it to the test set, where we saw good accuracy in resolving malignant samples with an area under the curve of 0.87. Encouraged by this result, we then went on to evaluate performance of our test in a never smoker population. Again, we were looking